Welcome to the 2025 Member Benefit Session video. Our presentation is designed to update you on any plan changes, new benefits, and information on what's new at Health First Health Plans. Make sure after the presentation you fill out the survey attestation to receive your $10 gift card in the mail. We'll cover 2025 benefit changes and 2025 prescription drug benefit changes. Across the board, Health First Health Plans has low-cost benefits for 2025, such as new in 2025, Part B giveback plan, $0 premium plans and primary care copay, more than 150 $0 prescription drugs, no referrals to see a specialist, more than 4,000 providers, no medical deductibles, worldwide urgent and emergency care, routine dental, vision, hearing, and OTC benefits, $0 gym benefit, non-emergency transportation. Now, let's discuss your 2025 benefit plan changes and updates. We're excited to announce some new and improved benefits for 2025. We've made some changes we think you are going to like. These changes are unique to the plan you choose, so we'll cover each change under that specific plan. First is a Classic plan. For those on the Classic plan, specialist copays decreased from $25 to $15. Mental health decreased from $20 to $15. Podiatry decreased from $20 to $15. Psychiatrists and substance abuse providers decreased from $20 to $15. Outpatient surgery and ambulatory surgical center max copays decreased from $0 to $150 to $0 to $100. OTC amount increased from $80 per quarter to $125 per quarter. We did have a few areas that saw an increase in cost share. Emergency room copay increased from $135 to $140. Worldwide emergency and urgent care copays increased from $135 to $140. Worldwide emergency and urgent care services outside of the U.S. are now capped at a $50,000 annual limit. This is only for emergency and urgent care services outside the United States. Therapeutic radiology increased to a 20% coinsurance. Diabetic supplies increased to 20%, but only applies to non-preferred manufacturers. Preferred manufacturers are still 0%. 30-day pharmacy on Tier 3 and 4 have some slight changes. You can see in the chart. For those on the value plan, your maximum out-of-pocket has decreased to $3,400. Urgent care and virtual urgent care copays went down to $20. Specialist copays are now $15. That includes virtual visit specialists too. Mental health copays are now $15 too. Podiatry copays are now $15. Inpatient mental health services are now $165 for days 1 through 7 and $0 for days 8 through 90. Psychiatrist and substance abuse are now $15. Opioid treatments are now $15. OTC amount increased to $115 per quarter. Diagnostic procedures and testings decreased to $0 to $20. Diagnostic radiology, MRIs, and CT scans decreased from $150 to $100. X-rays decreased from $30 to $20. Outpatient surgery and ambulatory surgical center decreased from $0 to $200 to $0 to $100. Observation decreased from $210 to $150. We did have a few areas that saw an increase in cost share. Therapeutic radiology now has a coinsurance of 20%. Emergency room copay increased from $120 to $140. Worldwide emergency and urgent care copays increased from $120 to $140. Worldwide emergency and urgent care services outside of the U.S. are now capped at a $50,000 annual limit. Diabetic supplies increased to 20%. but only applies to non-preferred manufacturers. Preferred manufacturers are still 10%. 30-day pharmacy on Tier 3 and 4 have some slight changes. You can see in the chart. For those on the rewards plan, OTC amounts increased from $60 per quarter to $110 per quarter. Your maximum out-of-pocket has decreased to $3,400. Specialist copays are now $15. That includes virtual visit specialists too. Podiatry copays are now $15. Urgent care and virtual urgent care copays went down to $20. Mental health, psychiatric services, substance abuse, and opioid therapy services now have a $15 copay. Inpatient mental health services are now $165 for days 1 through 7 and $0 for days 8 through 90. Diagnostic procedures and testings decreased to $0 to $20. Diagnostic radiology, MRIs, and CT scans decreased to $100. X-rays decreased from $35 to $20. Outpatient surgery and ambulatory surgical center decreased from $0 to $250 to $0 to $100. Observation decreased from $300 to $150. We did have a few areas that saw an increase in cost share. Emergency room copay increased to $140. Worldwide emergency and urgent care copays increased from $120 to $140. Worldwide emergency and urgent care services outside of the U.S. are now capped at a $50,000 annual limit. This is only for emergency and urgent care services outside the United States. Therapeutic radiology now has a coinsurance of 20%. Diabetic supplies increased to 20%, but only applies to non-preferred manufacturers. Preferred manufacturers are still 15%. 30-day pharmacy on Tier 3 and 4 have some slight changes. You can see in the chart. Finally, secure plan members. Your urgent care copay decreased from $30 to $25, and your over-the-counter OTC amount increased to $50 per quarter. Additionally, you will receive $1,000 every 2 years for hearing aids. We did have a few areas that saw an increase in cost share. Therapeutic radiology now has a coinsurance of 20%. Emergency room copays increased to $140. Worldwide emergency and urgent care services outside of the U.S. are now capped at a $50,000 annual limit. This is only for emergency and urgent care services outside the United States. Telehealth copay maximums increased from $0 to $20 to $0 to $25. Diabetic supplies increased to 20%, but only applies to non-preferred manufacturers. Preferred manufacturers are still 0%. New this year, we are offering a Part B giveback plan to those members in Indian River County. The Part B giveback plan includes Part B giveback of up to $148 per month in your Social Security check, $0 premium and primary care copay, no referrals to see a specialist, more than 150 $0 prescription drugs, dental, vision, hearing, and over-the-counter OTC. 2025 pharmacy changes. Standard Part D out-of-pocket cost. Annual deductible. Applies to Tiers 3, 4, and 5. The Health First Classic HMO, Health First Value HMO, and Health First Rewards HMO plans have a $0 deductible. The Health First Emerald Plus HMO plan has a $350 deductible on Tiers 3 through 5. Initial coverage phase. Cost share tiers apply, $0 to 33%. Coverage gap. The coverage gap or donut hole will be eliminated on January 1st, 2025. Catastrophic phase. $2,000 true out-of-pocket. After you reach your maximum out-of-pocket, you pay $0 copays for the remainder of the year. Payment plan option. Beginning in 2025, the prescription drug law known as the Inflation Reduction Act requires all Medicare prescription drug plans to offer the option to pay out-of-pocket prescription drug costs in the form of capped monthly payments instead of all at once at the pharmacy. We have more than 150 prescriptions that are at a $0 cost to you. We've updated the $0 copay list, Tier 1, and we now offer generic medication options for all of the following: asthma, lowering cholesterol, reducing blood pressure, managing cardiovascular disease, diabetes and blood sugar control, treatment of depression, antibiotics for infections, anti-cancer drugs, antipsychotics, antiarrhythmics, gastric reflux, treatment of benign prostatic hyperplasia. Novolin RN and 70/30 insulins are also Tier 1 with $0 copays for 2025. $35 copay for a 30-day supply of all other insulins. Includes insulin delivered via insulin pump. Novolin RN and 70/30 insulins are Tier 1 with $0 copay. $0 copay for Part D vaccines, including the following: hepatitis A, hepatitis B, Japanese encephalitis virus, HPV, rabies, tick-borne encephalitis, yellow fever, shingles, MMR, HIB, meningitis, typhoid, tetanus, pertussis, diphtheria toxoid, varicella. We have a nationwide pharmacy network available for members while traveling. For the most current list of in-network pharmacies, visit hf.org/directory and select Medicare Advantage plans for a directory link. 2025 Preferred Pharmacy Network. Within our Medicare Preferred Pharmacy Retail Network, you also have access to preferred pharmacies where your prescriptions can be filled at a lower cost. Supplemental Benefit Overview. We want to ensure that you have transportation to any health-related appointment scheduled, such as provider office visits, pharmacy, physical therapy, labs, and more. You have up to 32 one-way trips, depending on your plan, per year. Each trip is up to 75 miles. You can schedule same-day rides by calling our customer service department, or do it yourself by using the Roundtrip app or roundtriphealth.com/healthfirst. To aid in your recovery from an acute inpatient stay, you can receive up to 1 week of meals delivered to your home once you are discharged. A week of meals is the equivalent of 2 meals per day for 7 days for a total of 14 meals. The nutrient-rich meals are designed to speed up healing and get you back on your feet. If you qualify, a GA Foods representative will contact you to start your free meal delivery service. On the first day of each quarter, January, April, July, October, you receive an allowance of up to $125, depending on the plan, added to your prepaid debit card automatically. Medications such as cold and allergy medicine, vitamins, first aid essentials, and pain relievers are included. Participating retailers include CVS, Walmart, Walgreens, Family Dollar, Dollar General, Duane Reade, and Rite Aid. Your allowance does not roll over and will expire at the end of the quarter. Be sure to use it before the 3 months are over. This year, we also want to give you some tips on communicating with your provider. Here are some important topics to discuss with your provider to help you get the best care possible. Medications. Do you experience any side effects or barriers to taking your medications? Specialty care. Is your primary care provider aware of all the specialty care you are receiving? Falls. Have you fallen recently, or do you have issues with balance? Physical activity. Are you getting an adequate amount of exercise? Bladder control. Are you experiencing any bladder control issues? These are some typical questions that might slip your mind when you get to your appointment, but are important when it comes to maintaining your wellness. Also, take control of your health. Here are a few tips to help. Speak up. Bring a list of questions with you to your provider visit. If you are confused by the information they give you, let them know. Monitor your health. Don't ignore changes in your health. Telling your provider sooner can help you get the care you need. Appointments and medications. Keeping track of your medications and appointments helps answer questions about your health history. This helps providers know how to treat you. Stay educated. Ask questions about your lab results and your conditions. Understanding what is going on with your body will help you take care of yourself. Set your goals. Talk with your provider and set wellness goals. Focus on ways you can improve your mental, physical, and nutritional health. Some of the most important steps you can take in your wellness journey are your preventive screenings. These screenings are used to look for disease before symptoms are present. Talk with your provider to determine which screenings and vaccines are best for you. Here's a list of common screenings and vaccines. Vaccines. Remember, your provider is here to support you in all your healthcare needs. We've added even more information online for our members to use as resources. To navigate to the member resources, visit hf.org/yourhealth. Scrolling down, you will see wellness resources, along with a variety of category names. You can browse the categories for more information that you might find useful or informative. Documents here that you can download include Achieving Bladder Control, Colorectal Cancer Screening, Steps to Manage Your Diabetes, Balance and Fall Protection, Fall Prevention Exercises, Medication Therapy Management Program, Your Mental Health. Please don't forget to complete the survey attestation to get your $10 gift card. Thank you for being a Health First Health Plans member. We're glad you chose us to be with you on your wellness journey. We hope this presentation was helpful. If you have further questions or would like a copy of this presentation, please reach out to your customer service team